the project that we're going to be talking about today is a research study that we're wrapping up looking at strategies for improving services and help for criminal defendants with mental illness. I want to start just by introducing the partners in this study. It's been a lot of minds have come together to provide input into this effort, and so briefly, let me just run down the list. The Task Force on Indigent Defense, of course, has provided leadership for indigent defense policy and practice in general, and of course the issue of mentally ill criminal defendants has been a special focus of theirs. The Task Force Chair, Judge Keller, has a judicial leadership group that tries to bring together and integrate planning between the branches and with state agencies that deal with this issue. And the task force itself has been involved in supporting mental health public defenders in recent years. So there's a commitment to understanding better how to improve outcomes for mentally ill criminal defendants. In addition, the task force supported about 2/3 of the cost of this study, with the remainder coming from the State Justice Institute, a federal agency for court improvement. We basically got the idea for pursuing this as a research project because, you know, we looked around the state and we see that mentally ill criminal defendants are a high cost to counties because they tend to recidivate a lot and have other expenses. And in addition, at the same time that this challenge exists, we could see that there are counties that are taking leadership in this area and that are developing some promising approaches, and many of which are involving emerging and interesting new roles for defenders. And so we wanted to get out there and document some of these new ideas and see if there were nuggets we could pull from their experience and that other counties could benefit from, and also to document the impacts of and the payoff that counties might expect if they're able to implement some of these new practices. So that's been the task force role. In addition, our other major partner has been the National Center for State Courts, which of course is Laura's group, and their role in the study was to conduct the process site visit component, go out into the counties, visit with the main stakeholders involved in mental health programs, and try to document the processes that were underway. My office, the Public Policy Research Institute at Texas A&M, has been involved in the study we've been primarily responsible for the data analysis component, which has been a large undertaking. We basically took a 5-year population of criminal defendants from each of the 3 study counties, Dallas, Tarrant, and Travis counties, and matched that with the mental health records available from the Department of State Health Services. So that gave us a full picture of these defendants' mental health history as well as their criminal history, and we could tie that information together and see what changes for those that have access to these new programs. Also a partner has been the Council for State Governments, which Tony Fabello is not represented here today, but he's been a good source of additional expertise based on their national experience in this area. And then last but certainly not least are the counties that allowed us to come into their jurisdictions and generously gave us interview time with people that work with these programs, and also very generously worked with us on compiling the data sets that we needed to actually measure these outcomes for mentally ill defendants. Judge Carr, of course, is with us today. He's he is the mental health court judge in Tarrant County, and will be able to show some of the impacts of his work. Also, we've got the other 2 counties, Dallas and Travis, are represented today. So just a special thank you for their help throughout this whole effort. So what have we learned? So far, well, we're at the end of the first year of the study, and to be clear, we have a lot more data analysis ahead, so I hope when the final report comes out, you'll revisit this issue and see the new information that I'll be able to add in addition to what I'm able to speak to today. But so far, we have learned at least one very clear lesson, that engagement matters. Where mentally ill criminal defendants have access to some type of treatment to help them manage their sickness, there are better outcomes. And when I say better outcomes, I mean not only for the defendants themselves in terms of their personal well-being, but also for the county governments and local criminal justice systems that encounter these individuals. So we know that treatment and access to treatment improves outcomes for these individuals. How do we know that? Well, we looked at the data. This graphic shows the effect of mental health service engagement on the chance of 6-month recidivism. And so if you look at the high end of the bar, that represents people, well, let me back up. If you look at the low end of the bar, 6 months out, according to the bottom of it, people who were fully engaged in mental health services, receiving services at least in each of the 6 months preceding their arrest, so we know they're regularly involved in mental health services, those individuals are significantly less likely to recidivate after an arrest than the same individual who was arrested but had not been previously engaged in treatment. So what we see is someone who has a mental illness but is actually getting help for the illness is less likely to recidivate. So what we want to do is find ways to get people engaged in that treatment so that once they've had contact with the justice system, they're less likely to come back. Let's see. So how are counties doing this? How are counties getting criminal defendants engaged in treatment? Well, in the 3 counties that we visited, there were lots and lots of different components. Looking just briefly, and I won't review specifically all the different programs that are in place in each of these counties, but on the whole, if you look at the programs overall, they span all phases of case processing, including jail contact, pretrial, the pretrial phase, the post-disposition phase, probation, and also even extending into helping criminal defendants after they've re-entered the community and have exited from the justice system. So they span really the full array of, there are a lot of, there are a continuum of impact points at which counties can potentially intervene to help these people with mental illness. The other thing that we observed was that it spans all different types of actors, like judges, prosecutors, mental health, community mental health providers have a role in many of these programs. And we also noticed that there are, in these new programs, emerging innovative opportunities for legal defenders to take a role that they've not traditionally taken on in terms of specializing in assisting people with mental illness. We saw, for instance, in Travis County, they have a special wheel of trained attorneys that are qualified to represent people with mental illness more competently. When mental health public defenders, we see social workers that are teaming up with the defense to help get these people engaged in treatment and thereby cut down on their future contact with the justice system. And where we saw as public defender offices mature, we also see that they seem to be able to branch out and actually improve the overall infrastructure in other parts of the county and strengthen capacity overall for improving outcomes and increasing treatment engagement for people with mental illness. So at the end of the day, we do know that engagement in treatment services improves defendant outcomes. The challenge for counties is to find good ways to make that link occur. And Laura Klaversma is going to speak to some of the things that we saw in site visits.
So what does it really matter to you? I guess if you're thinking about what can I do different, what can I do to improve, and what does that have to do with the mentally ill? Well, as we know, mentally ill people are overrepresented in the justice system, which means that it costs more money. They keep coming back again and again and again, and that costs money to the counties, money to the communities. So not only in having a mentally ill court are you thinking about is there a way to help people, you know, the touchy-feely stuff that some of you may or may not care about, but you're thinking about really the money you can save in a community by having this kind of a process, by keeping people out. And so that is a good goal. And as Dottie said, one of the things we found is you don't have to do everything and you don't have to do it the same. To me, that was very exciting because in working with problem-solving courts, it is a resource-intensive model, and that means resources really is a nice word for money, isn't it? And so it costs a lot sometimes to have that full model. And what we learned is there's a lot of ways that you can engage mentally ill defendants early on and have successes. So that can be a gamut. So then we came to, so what does a community do? What do you look at? What can you consider? And we decided the most important thing was to come up with themes. Whoops, went too far there already, huh? Strategies that were kind of had ideas that made success happen, not necessarily say that the model needs these 10 or 12 things in it, or your court needs these things, or your community needs these, but instead look at the themes that make it work. And the first thing, and I think this is one of the most important, is prompt identification. Early on, engaging the person, knowing who they are. Through interviewing, assessment, databases are out there. Different communities had different ways of looking at it. But the important thing is, if you engage them early on, get them into treatment early on, there's less burden, less resources, because you're keeping them out and getting them back in the community earlier. Less recidivism, of course. The second thing is to have clear eligibility. And each of these courts we looked at definitely had criteria, though it's not always the same. And again, back to themes versus concrete things everybody has to do. Clear eligibility, clinical eligibility means making sure that that matches with what your resources are in the community. Making sure that what you've got out there matches the kinds of people you're trying to identify early on, as well as the kinds of justice eligibility. What's your target population? What kinds of people do you think you can best help with the resources both in the justice system as well as in the clinical community will best work for you? And the third thing, and I think this is great, this morning, thank you to Hidalgo County, talking about politics, talking about stakeholders, bringing people together. Who are those right people you need to bring together? Very important. You have the police, the sheriff, the corrections, prosecutors at the table. Of course, your public defenders or your criminal defense people need to be at the table, as well as your judges, judicial people, court administrators. Bring people together, figure out what your goals are. And our very first presentation, Judge King talked about the mission, the very first thing. Figure out what you're trying to do here. A lot easier once you know what you're trying to do, who you need to involve, and what you're going to do to get there. Strong judicial leadership and commitment. One of the things they found in mental health courts around the United States is that many of them look a lot like what the judges thought they should look like. Judges kind of help design them. So it's important to bring judges into this early on. Whether it's a public defender model, whether it's a docket, whatever, you need them at the table and leading. And another advantage of that, of course, is institutionalizing, which I'll get to in a minute, but keeping that program along the way. When you have mental ill courts or dockets or some kind of program like that, you're going to have a new role for prosecutors. Prosecutors are used to thinking of, the crime and just getting whatever the sanction is that they need to come up with. Instead, they have to think a little bit deeper, if you train them, about how can we work together as a community to have this person so perhaps they don't come back again. It's a broader way of thinking. And of course, that involves training all the participants, all the players in the community, as well as new strategies for the defense counsel. And Dottie mentioned this, and this is a very important area, because the defense people, I wanted to get my note here because it was really good, they play a key role because they ensure that the defendant knows their options. You're dealing with mentally ill people, perhaps on or off medication at that time, and they need, as anybody does, to know what their choices are to make good choices. And that role really falls heavily on the defense counsel. Again, back to training and knowing what illnesses they're dealing with, what the ramifications are, can help them help these people better. Another key element we found, and it's done differently in different places, is case management. Again, early identification, managing this through the whole process, making sure that these cases are taken care of, that these people are guided, that they're hooked up early on to treatment. this is really an essential element, and how it happens is in different places. We were talking yesterday to the gentleman from, I can't see him over there, Harris County, talking about the importance of hooking people up with a public defender as well as a social worker, and together they manage this process through the system, this person. Making sure you have sufficient treatment and services in the community. This is an area in problem-solving courts particularly that's a problem, because some smaller communities may not have the resources. There's a lot of way to look at it, and sufficient only means looking to see what's out there and making sure you're connected with it well. And so I gave you some examples. Some of the things, definitely Tarrant, Travis, and Dallas have all looked at their community to see what their services are. But that is one of the key things, is making sure that if you're dealing with mentally ill people, you have services there and you're connecting with them and bringing them to the table as well. And the last theme is to make sure you institutionalize the program. So often we get into exciting new ideas, and we saw this so much in problem-solving courts 10, 12 years ago. People had money to get started, but then they didn't have money to carry on when the planning and the initial funding ran out. And so what do you do to institutionalize? And there are a couple things right up front that are very important. Again, back to getting at the table and talking to people. The first thing you need to do is set up your performance measures. Funders want to know this is successful. So you've got to set the performance measures up early on. What are they? What are you trying to achieve? And most important is outcome. Recidivism, people coming through. Determine what those are and make sure the data you're collecting tells you the story, so that as you try to get funding in the future, you've got documentation to show why this program works, with numbers of people as well as dollars and cents. I think that's it. And we're going to find out some data to support all the things I just told you here.
Okay, so we ask ourselves, if we have programs in place that are doing a good job engaging people in mental health services, what impacts might we be able to measure on individuals' experience in the criminal justice system? As I said before, we're still developing the study, but we do have outcomes available on two programs. The first is Judge Carr's Mental Health Court in Tarrant County, and the second is the Mental Health Public Defender Office in Dallas County. The chart that I've got up right now, or the graphs, show what happens to mentally ill people without the assistance of these programs to get them engaged in treatment. You can see that on the whole, people with mental illness are much more likely to recidivate within the first 6 months following their arrest compared to the base group, which is people without mental illness. And you can see that it's split out by diagnosis, so that schizophrenics are the most likely to recidivate. That's true in both Dallas and Tarrant counties. When we have access to special programs to get these individuals engaged in treatment while they are in contact with the criminal justice system, we see dramatic reductions in 6-month recidivism through both programs. And what's really remarkable is it drops the rate of reoffending among mentally ill people below even the rate of reoffending for people without mental illness. And not just a little bit below, considerably below that base rate. Of course, for counties, this is going to translate into cost savings. And we hope to be able to demonstrate by the end of the study that these cost savings would be significant enough to certainly offset the cost of these programs to make these things happen. So we were... I would also like to pause just for a moment to thank my colleague Trey Marchbanks, who is responsible for these numbers that you see up here. And while they look very straightforward on little bar charts, you need to know that there's a lot of statistical complexity underlying these. These measures control for everything that we know about defendants, so that we're comparing like defendants in both groups by all their demographic and personal attributes, as well as their diagnostic characteristics. So it's much more sophisticated than these little bars indicate, and I wanted to give him tip of the hat for his work helping us get this information. The other measure that we looked at, or the second measure that we looked at, was we know that one of the special attributes of mental health public defenders is that they're able to advocate with judges to work out non-jail oriented dispositions for people with mental illness, in part because they do have treatment services that they can engage these individuals in. And so we looked in Dallas County at the rate of opportunity for probation among people with mental illness. And we can see that on the whole, people with mental illness do not get the same access to probation as do people without mental illness, the base category. However, when we have a public defender advocating on their behalf and who has established relationships with judges and can connect these individuals can assure the court that they can connect these individuals to treatment, we see that access to probation increases. And again, it increases more than probation rates for people who are not mentally ill, with the single exception of schizophrenia. But still, there's a dramatic increase even in probation rates among those individuals. And again, these are people who are not spending time in jail, so it does translate to cost savings. And the last thing that we were able to look at was another outcome that we hope to see is that people with mental illness, once they go through the criminal justice system, can actually continue to benefit from it through sustained engagement in the mental health treatment system even after they leave the system. So we followed individuals 6 months after their arrest who did not have access to any special programs or services, and we can see that on the whole, engagement in services relatively low for most people with mental illness after an offense. However, when we give them the supports they need to link them with these services, their participation doubles in many instances. And so on the whole, there's a long-term benefit for the individuals that are being served by these programs. So, at the end of the day, we are able to conclude that engagement definitely does matter, that there are a lot of ways through which we can take advantage of the time that individuals with mental illness are in touch with the justice system to give them the tools and resources in terms of treatment that they need not to be back again in the very near future. And we also can see that there are a lot of emerging and innovative new ways to approach that. And again, I think some of the most interesting and the newest do have to do with different ways of thinking about how defenders can contribute to that process. And at the end of the day, everyone benefits: criminal justice systems, families, and individuals with mental illness.